The Arthrex iBalance unicompartmental knee arthroplasty system is indicated for resurfacing of a painful arthritic compartment of the knee joint in a minimally invasive manner through smaller incisions. Single compartment resurfacing has been shown to feel more natural than a total knee replacement by sparing normal tissue and facilitating a more active lifestyle. After your surgeon makes a small incision over the front of the knee, a guide is secured to the tibia and used to determine how much of the tibia to remove. After removal of only the diseased portion of the tibia, the guide is removed and an innovative knee space measuring system is employed to make sure a minimal amount of bone is resected on the femur to allow for matching of the correct size implants. These magnetic spacer block guides check the stability of the knee throughout a range of motion to ensure that your knee is balanced after the procedure and feels natural while walking. Once the gaps have been determined with the spacer blocks, specialized linked cutting guides are secured to the femur to remove only the diseased portion of the bone to prepare the femur prior to sizing the implant. Before final femoral preparation, the balanced gaps are checked one last time. Final sizing and preparation of the femur includes drilling holes to accept the pegs of the new femoral resurfacing implant. Prior to final preparation of the tibia, trial implants are placed into the knee to make certain they are the correct size. The cut surface of the tibia undergoes final preparation to prepare the bone for the fixation posts on the back side of the tibial implant. The tibial implant is cemented into place, followed by the femoral implant and the plastic bearing surface.